Welcome everyone to the first Wednesday seminar of the academic year in Department of Population, Family, and Reproductive Health. I'm Cynthia Minkiewicz, chair of the department, and it's really my honor to extend a warm welcome. And we're so excited with the start of first term. I've had the pleasure of seeing some of you on campus earlier this week. Our seminars to start off the year will be virtual. And then once our usual seminar room is available for hybrid learning, we're hoping to convert that so that those of you who are on campus will have the opportunity to actually connect with folks in person. So this is a tradition for our first two seminars that Bob Blum started when he was chair. And we call these stories of our faculty. So we thought it'd be really fun for those of you who are new to the department and those of you who are continuing, as well as for faculty and staff, to get a sense of what makes faculty so passionate. What makes us tick? What gets us excited to wake up and start our work each day and to work with all of you? And our stories are all unique. They're all different, but they'll give you some idea of what sparks us and our passions. And folks have really enjoyed it. So what we're going to do today is have some of our faculty share their stories with you today, and some will be sharing next week. Following that, we'll have a series of different topics that are addressed during noon seminar. And with hats off to Dina Durham for organizing us. You'll hear about different themes and topics and methodologies that are integral to the work that we do in the department. So despite all of our differences of experiences and training and our research and practice and pedagogical interests, there are two things that really connect us as a department that our new students heard about at orientation, and that's our focus on population and our focus on life course. So as different as our speakers will be over the academic year, hopefully it'll expose you to some new ideas, some new ways of thinking, and opportunities to challenge our thinking and learn with each other. So we're excited about the speakers we have lined up, and we'll be announcing those both on our departmental website and then in emails that you'll get weekly from the Office of Communications in the department. So with that, we're going to go ahead and get started. I just want to acknowledge that we've heard from a number of you that there are serious connectivity challenges with Zoom today that are beyond our control. We have multiple people who are hosting and co-hosting this session, so hopefully that won't be a glitch. But bear with us if we experience any connectivity challenges. We've learned to become very adaptable over Zoom in the past year, and we'll continue that moving forward this year. And so we're really hoping that all of you, wherever you're at, are staying well and safe amid COVID. If you're on campus, that you're, again, being safe and well, wearing a mask and learning your way around the building for those of you who are new. I'm going to invite Susan Gross to be our first faculty member to share her story with us. Susan, welcome.
Thank you, Cynthia, and good afternoon and welcome to our new students and our returning students and the faculty and staff who are here today. My name is Susan Gross and I'm Associate Scientist in the department. And my story actually starts 30 years ago today. Today is actually my 30th wedding anniversary. And the way that relates is that I got married actually 1 week before I started my PhD program in what was then the Maternal and Child Health Department, which eventually merged into our Pop Fam department now. So I have so many memories of 30 years just reflecting back today, but actually at the very beginning of my PhD program, I met Dr. David Page and we started working together on a breastfeeding program for the Peer Counselor Breastfeeding WIC program. And we were doing an evaluation of peer counselors. Well, after I finished my PhD, I continued my breastfeeding studies with David, and I became pregnant with my first child, and I was very worried about whether I'd be able to breastfeed because I'd been doing so much research related to breastfeeding. And luckily for me, everything went well. And so when I had my second child, I was just very confident that everything would go well. But what happened was when my son was 3 months old, I was in Toys R Us, a store for children. It sold breastfeeding supplies, and my son became hungry. I sat down on a bench and began to nurse, and I was approached by the staff of the Toys R Us and they said, you can't breastfeed in here. It's not appropriate. There are children in here and we don't want them to see it. Well, based on all the research and background I had, I was able to say, wait, there are laws that protect me against this. And I was able to say, hey, you shouldn't be doing this. This is against the law. Well, what I found out was actually there was no law in Maryland to protect women for breastfeeding in public. And so I was able to gather my resources and all of my support from the department as well as my community contacts. And we were able to work with a senator at the state level and pass a law called the Right to Breastfeed. And what I found was the resources we learn here, our ability to advocate, we can use our personal experiences as well as our professional experiences to move forward practice. And this has become my passion. In all of my research, I take personal experience as well as the voices of the people I work with, and I try to use that implementation of the research I do and translate it into practice and policy. So thank you for this opportunity to talk, and have a great year.
Susan, thank you so much. I think that story, I put a note in the chat, evidence-based advocacy and policy making it work. So whether folks are doing their work here locally in Baltimore, at the state level, nationally or globally, that really is, I think, a story that is the face of our department in terms of really being very applied in what we do. So thanks for sharing. I'm going to invite Bob Blum to join us.
Thanks. And it is a tremendous pleasure, particularly to see faces and names that I've never seen or met before. And I look forward to the opportunity to meeting you both over Zoom and in person over the coming year. I had the opportunity to come to Hopkins in 2004 and to serve as the chair of PFRH until 2018. In thinking about a story that might give you a little bit of insight into me, I first want to apologize to the faculty because after 20 years of telling stories, it's hard to come up with one that hasn't been something I have told before. I grew up in New York City. I grew up in relative advantage. I went to an pretty much all white school in the city. I went to Lafayette College, which was all male and probably 95% all white. The reason why that's relevant is because throughout my college career, I felt that my life and world experiences were profoundly limited. And I wanted to go to medical school, and I applied to Howard University. I remember distinctly my interview. I was interviewed by a giant of a human being, both in size and in intellect, LaSalle Lafall. And Dr. Lafall, who was a cardiovascular surgeon, leaned across the table interviewing me, and he said, "Blum, what's a white guy like you wanting to come to a place like this for? Howard University." And I have no idea what I said as a response, but it was a sufficiently acceptable that I was offered admission, and I went to Howard. I would also fast forward that 30 years later, my son went to Howard Medical School, as did his now wife, who he met the first day of medical school. Anyway, so I went to Howard for all the wrong reasons. I went to Howard expecting it to be a hotbed of political activism. This was 1970. The Vietnam War was going on. There were demonstrations and protests throughout Washington, D.C. And I felt being at Howard would be at the center of political activism. I learned very quickly that you are not Black and particularly poor because probably half my college classmates, of which there were 100, came from low-income rural communities where they were picked out, often by their church, and supported. And you don't get there by shooting your mouth off. I was expecting much more activism. Fast forward to the end of that year, the end of the academic year, 1970. And 4 kids were killed at Kent State University. Many of you were not alive at the time, but some of you have read about Kent State. It was transformative. The country shut down, universities everywhere shut down, and there was a huge march on Washington. I was very involved with Physicians for Social Activism group that coordinated the healthcare and medical staffing of these demonstrations. And Howard was debating whether to shut down. There was an all-school conference where we were to discuss whether the medical school would go out in sympathy. And there was the debate going on, and I stood up and spoke. And I spoke with passion about why Howard should shut down in sympathy with everyone else. And when I was done, from the back of the room, a classmate of mine stood up and said, "Blum, tell us about Orangeburg." I said, "What?" She said, "Tell us about Orangeburg." And I had no idea what she was talking about. And I said, "I'm sorry, I really don't know about Orangeburg." And she said, "That's why we're not shutting down." The place erupted in applause, and I sat down in my seat, not knowing what hit me. I learned what Orangeburg was. I learned that in 1968, kids were killed at a historically Black college in Orangeburg, South Carolina, for demonstrating, and no one knew about it. Certainly no one who was white knew about it, and I didn't know about it. I was so convinced the time had changed, but it hadn't. Just 2 weeks later, after the killings at Kent State, 4 students were killed at Jackson State. No school, no university, no college shut down. Howard shut down. There was a small announcement in the Washington Post that Catholic University was holding a memorial service. That's it. No one even acknowledged it. Howard had a week of mandatory Black awareness. You had to be on campus. It was the end of the academic year. And being white at that point in time was chilling, challenging, and life transformative. I learned a profound amount from those experiences. There was a fad in the 1970s of wearing pins that conveyed political, social messages. And the pin and the slogan that had the most profound effect on me was one that said, "Think globally, work locally." And I think that's the bottom line. Here at Hopkins, think globally, but your obligation is to work locally, whether it is in Baltimore or somewhere else, to make the community a better place than you entered it. And my experience of those who protested at a meta level often had zero impact at the end of the day. Thank you. I look forward to meeting you all in person.
Thanks so much, Bob. And I certainly have heard that story before, but every time I hear it, I glean different messages from it. We're at a time now where in our department, led by an incredibly strong committee and Terri Powell, we have a lot of focus on inclusion, diversity, anti-racism, and equity. Some of these same issues challenge us, but I think we're poised in a different place to take action and work locally to address them, as well as in broader spheres. And so for our incoming students, you'll learn a lot more about these activities in the upcoming weeks. I think the other message that I heard is just how incredibly fortunate we are to be surrounded by such compelling peers. And so as you look around on Zoom, you see each other in seminars and in small group settings. These are going to be some of your formative, sort of next steps and experiences for learning. So we look forward to sharing that learning with you. So thanks so much, Bob. I'm going to turn it over to Phil to say hello.
All right, thanks, Cynthia, and hi, everyone. I'm Phillip Levich, and I'm an associate professor in Pop Fam. And I have to say, echoing Cynthia's comment, that although I've heard Bob's story before, I love hearing it every time and find it really important and inspiring. So no need to apologize for repetition as far as I'm concerned. And I think for my story, I'm going to follow maybe with some similar themes that Bob described in his, where when I think about what brings me to work every day and why I'm doing what I'm doing, really traces back to my time as a Peace Corps volunteer in Malawi, where I served between 1998 and 2000 in northern part of the country, in a village called Perembe, which is close to the border of Zambia and Malawi. So as many of you know, during this period in African history, the continent was being ravaged by the HIV AIDS epidemic. And certainly that was noticeable in the village where I lived. So my colleagues and my friends there were terrified about becoming infected. Their friends and their family members were passing away and becoming sick. And I went to multiple funerals every week. So it was truly a frightening time with a lot of uncertainty, in a time where there was great need for effective public health programs. So that's what brought me there. I was trained as an HIV AIDS educator. So I was instructed to go around to local health centers and schools and other venues and teach people the basics about HIV, how it's transmitted, how to avoid infection, using condoms, and so on. So for the first 6 months that I was in the village, that's essentially what I did. Then after I was there for 6 months, I remember having a conversation with my friend Austin, who was my local liaison to the village and helped orient me and helped me figure out what I was doing, where I was going. And true to fashion in Malawi, he's very polite, just wonderful guy. And he started off by saying, Phil, we're really glad that you're here in Perembe. You're entertaining. We think that you're a little bit odd, but you provide entertainment for us, so we're glad that you're here. But I'm wondering, with your HIV message, is there anything new that you can tell us? Because we know everything that you're telling us already, and basically everybody knows this. So, is there anything new that you can do? Is there any new information you can provide? And I said no. And so I realized that there is a fundamental disconnect between the program that brought me there and the needs of local population. I'd been told that Malawians weren't talking about HIV, that they weren't changing their behavior, and that they needed to know some of the basics about transmission. None of that was true. And I quickly learned this. So, having experienced this disconnect between programs and needs of the population, that inspired me to go to graduate school, where I joined a study that was a longitudinal panel in Malawi, in rural Malawi, and looked at HIV/AIDS dynamics. And we found through this study that the main HIV program at the time, the ABC program, which stood for Abstain, Be Faithful, and Use Condoms, was, I think, fundamentally misguided. And it didn't meet the needs of, or it didn't really fit with the local population practices and their beliefs. Where, for example, abstinence is just simply not realistic over a long period of time for a population. Using condoms in Malawi is only culturally acceptable in certain circumstances and for certain types of relationships. So a lot of these programs miss the mark. But it's not like Malawians weren't doing anything. They developed their own strategies that made sense within the culture of the population. So for example, they were scrutinizing the likelihood of HIV infection for potential partners, and they were divorcing themselves from partners that they thought were a risk of HIV infection. So it's not like they were doing nothing, but you had to know what they were doing and look elsewhere outside of, what we've been instructed to do to find out what was actually happening there. So in short, I think there was plenty of activity to avoid HIV infection, but you wouldn't know it unless you had the right measures. And all this leads to a fairly simple point. Whether it's HIV infection, family planning, or COVID, we need data to inform programs. And the data have to be not only clean and accurate and well collected, but they have to really reflect what's happening on the ground. And if you don't know what your local population, the population you're working with very well, the data you collect might not be very worthwhile. And ultimately, I think it's safer to maybe assume that you don't know what's happening as well as you think you do, because that might lead you to a more effective direction with your work. And it's also more fun, I think, to learn about a population that way anyway, by assuming that you don't know much about them and maybe what you write is incorrect. So that brings me to what I do here. So here I'm the PI of Performance Monitoring for Action project. And we collect data on family planning and contraceptive use in 8 countries worldwide. And the goal of these data are to inform local programs in family planning, and they're only effective if they're well informed. So I bring a lot of what I learned in Malawi to PMA. So in short, that's what gets me up each day. That's what motivates me. Thanks for your attention, and look forward to hopefully meeting you all in person at some point.
Thanks so much, Phil. Also, another great sort of a story, Bob brought up the theme of think globally, act locally, and I think we can amend that to be listen locally, and really hearing from our partners what is actually happening on the ground. So Momo wrote in the chat, amazing experiences, and I completely agree. So thanks so much. I'm going to invite Beth Frederick to join us.
Thank you, Cynthia. And many of you, not all of you new students, but many of you know that I love telling stories. And so yesterday I was spending a lot of my time trying to prepare one that I thought would give you a sense of my work and the department's work and everything that we do at Hopkins. And I woke up this morning and realized that all of the stories that I thought I would tell were terrible. They just didn't quite make it for me. And part of the reason is because we're in a situation right now in the world where we're looking to Afghanistan and we're looking to our role in the world. And I thought back to 20 years ago when the World Trade Centers were to 9/11. And I thought maybe that would be a useful thing to share with you all, because I was working at the time with the Guttmacher Institute, and our offices were at the base of Wall Street, and we were in a high rise there. And we were working on all the different things that the Guttmacher Institute works on today, which is sexual and reproductive rights and health. On the morning of 9/11, I was voting for the mayoral election, in the mayoral election. And so I didn't make it into the office when everybody else did. And I was stuck at home, and the phone rang. It was the last phone call I got until later that day. And it was from one of my colleagues who said, "We're sheltering in place. We cannot go out. There is so much soot and dust in the air that we have been told that we cannot leave our office." Eventually, they all went home. And I got the next call from the president of the Guttmacher Institute, Sarah Symes. And she said to me, "Our first priority is figuring out where all of our people are. We have to find out that they've gotten home safe." So we put together a phone tree and found out who was still stuck where they were and got everybody home and made sure that they had the medical care they needed, because some of them were coming out of the train station when the first tower fell. The next thing she said to me is that tomorrow morning, you're going to come to my apartment and we're going to call all of our funders, because our work needs to continue. And we know that there's going to be a disruption, and we know that we're not going to be able to raise money because there'll be other priorities. We have to focus on the work. We have to do that. And so I took the subway through the World Trade Center station and up to her apartment on the Upper West Side. And we called every funder and asked them for help so that we could continue our work. The final thing she said to me that day was, Now that we've got everything taken care of for the people and the work, we need to focus on the mission, because there is something more important and continuing to be important when it comes to women's people's sexual and reproductive lives. We cannot let this distract us from where we're going. And I take that with me today. We're in an extraordinary period with COVID-19. It is decimating communities and families, and it's also a distraction for all of us as we work through Zoom and everything else. But I remember when we first shut down in the pandemic, the project that I work on is advanced family planning. We're a multi-country advocacy initiative, and we were at our partners meeting 2 weeks before the full lockdown. And when we came back, no one knew what the future was going to hold. So I'm leaving with you that what I thought of first was my people, the people around the world who we work with, and the people here in Baltimore that are on our team. And then I thought about the work and what we needed to do in the short term and the long term to keep it going. And finally, I took solace from the fact that we were doing the right thing, and we were looking after the reproductive health of people around the world. And that's it. I'm getting a little teary. 9/11 is a long time away for some of you students, but in telling the story, it comes right back to life for me.
Beth, thank you so much for sharing. And for any of you who wondered what makes PopFam a PFRH community, I think Beth really spoke to it well. We prioritize our people, and by our people, I don't just mean our department people, but the people with whom we engage, we work for, and we work on behalf of. And that's something that is a top priority for us. As we're thinking about our times now, still amid COVID, prioritizing each of your well-being and helping each other still remains foremost, and also remaining mission-driven and accomplishing our work, even amid really challenging times. So I think all of those themes, Beth, are just so critical. So I really want to thank you for telling that story in such an impassioned way. And I'm actually pretty sure that many of the other stories that you could have told would have resonated too, but the one you shared was particularly meaningful. So thank you. I'm going to invite Alison Gemmill to join us.
Great. So I just want to say, Beth, that was a really great story. I got emotional too. I see that Sally said she was tearing up, and yeah, 9/11 is very palpable. And I worked at that office, but not at that time, but I know how close it was to everything. So I can't even imagine. And, you know, the events that are going on recently, they are weighing really heavy right now. And especially what's going on in Texas, it's devastating. So yeah, let's continue our work and our mission. So my story is not so much a story of how I got to where I am today. I didn't have a brilliant aha moment, although I appreciate hearing all the other aha moments that people have had. I actually just wanted to talk about some stuff about being in graduate school and academia, and then I'm going to sprinkle a few of my own anecdotes throughout. But I wanted to talk about 6 little points. So the first one is that it's okay to be a late bloomer. So I did not start graduate school until I was 29, 30. And I think that was for the best, because it took me a long time to figure out what I wanted to do. So that's number 1, it's okay. Number 2, professors get imposter syndrome too. I get imposter syndrome to this day. So this is the feeling where, oh my gosh, people are going to figure out that I don't know how to do what I know how to do, or I don't know that knowledge that they think I do. You know, self-doubt is part of the job, but being aware of it is a first step, and just believing in yourself and finding that inner strength to get past that imposter syndrome is good. So it's okay if you feel it, but you will get beyond it. Number 3, follow your interest and curiosity. And be willing to defend your ideas, especially when they're out of the box. I don't know if it's because I did my training at Berkeley, but I have a lot of out of the box ideas, and you know, it makes me question if they're good or not, because nobody's thought of them before. But that's some of my best work. So believe in what you're interested in. Number 4, connect with your peers. So I have such important friendships and collaborations that I've developed through my time at graduate school. So hopefully you will do the same. Number 5, writing or academic writing is a skill that takes practice, practice, practice. So I have never thought of myself as a good writer, but I've realized it just takes a lot of time and energy. Don't delay that first draft, just get it out, because writing is thinking. And then number 6, there is never a right time to have children. I had 2 children, or I had 2 pregnancies during graduate school. Was it ideal? No, I didn't have all my ducks in the row, but you know, they're healthy, we're happy. So if you want to ever talk about that, I'm available. But those are my 6 points with little stories. And I really look forward to seeing all of you eventually and virtually in the meantime. So thanks.
Alison, thanks a ton. I love the 6 stories, and I love the one particularly about children. Even when people plan out the specific date or the month or the year, I don't know that as parents, anyone's ever completely ready. So there is a reason why we have family in our department name. There are many reasons. And I think you're hearing about some of them today in terms of our orientation in our personal lives as well as in our work. So that was really, really awesome. All right, I am going to invite Dylan Jackson to say hello.
Hello, everyone. It's such a pleasure to be here. My name's Dylan Jackson. I'm an assistant professor in the Department of Population, Family, and Reproductive Health. This is my 2nd year in the department, so I'm fairly new. I'm excited to be here. It feels like this past year flew by. And Alison, that was really inspiring. I feel like that was a little pep talk for me, just directly at me. So thank you, even though I know it wasn't supposed to be for me, it relates to what we're all going through. So I think that the best way to talk about why I'm here is to kind of give a life course perspective on my life. I don't want to take up too much time, but so I was born and raised in Los Angeles, California. And like Bob, I had a pretty comfortable upbringing, didn't realize kind of how fortunate and privileged I was, as is usually the case, because you're kind of exposed to a lot of, just a handful of experiences, and your experiences can be really narrow. But I did have kind of a number of experiences growing up in school and with peers and with friends that made me realize that often people don't understand you as a child and as an adolescent. They can often pigeonhole you, put you in a box, stigmatize you, make you feel as though you're alone and you have no one to trust in. And I was lucky because I had a number of people to support me through those challenges. And they were really minimal, right? Because in a structural sense and a systemic sense, I had every opportunity in the world. And so I think I understood at a basic level what it meant to be labeled and misunderstood and stigmatized. And so I was really interested as an undergrad in going into child psychology, because I really wanted to support children through those challenges and make them realize that they're strong and that they're beautiful and that they're powerful, regardless of what other people might think, right? Or how other people might treat them. So I went into my undergrad in psychology and really wanted to be a child psychologist. And as I started studying, I realized that it wasn't quite for me in terms of the career. And I felt very much like what Alison said. I kind of felt like I needed to have it all together and have a plan. And I really didn't. But as time went on, I thought, I'm going to try to get some other experiences and engage in some service and engage in some community-based activities that might kind of expand my horizons. And I decided to work for a detention center. So I worked in Slate Canyon Detention Center as an undergrad. And I worked there for about a year, and it really changed my perspective. It wasn't one aha moment, but there were several when I worked there that made me realize that the stigma and the labels and the pigeonholing that I experienced when I was a kid didn't compare to what we had been doing collectively as a society to these youth in this detention center. And it really made me realize that those systems really aren't designed or hadn't been designed and still aren't in many respects to support youth, but instead are designed to pigeonhole them, box them in, and stigmatize them. And it just broke my heart in that job. And I remember struggling with whether I should continue to work in those spaces and try to change those systems from within, or whether I needed more education and more expertise to really make a difference, because I felt like those spaces didn't really have the structures in place to make those changes. I remember when I worked there, I went in super kind of bright-eyed and bushy-tailed to try to support the youth and make changes and inspire them. And I realized that that just wasn't possible in that space. At least I didn't feel like I could, because I would go in and say, I'm really excited to kind of, make change and think about, reform and rehabilitating youth and inspiring them for their future. And all the staff and my superiors were like, what are you talking about? This is just a holding cell, right? This is just a place for them to be, and we just have to manage them. So you're going to be doing suicide watch. You're going to be strip searching people. You're going to be doing intake. And it was so demoralizing and dehumanizing to these youth that I thought, I've got to change this system in a different way. I can't continue to work in this space unless things change. So I went to graduate school and I decided I'm not going to be a child psychologist. I'm going to be a criminologist. So I went to graduate school in criminology and criminal justice, studied for 6 years at Florida State, and realized that even in graduate school in criminology, there were some problems with the ways that youth were being talked about and stigmatized, and really kind of essentialized as offenders, right? Or essentialized as criminals. And it took me a while, even after my dissertation, to realize that those spaces, while I learned a lot in them in graduate school, didn't really reflect my values and reflect kind of the changes that I wanted to see in the world. And so over the last 5 years, I worked as a faculty member in a criminal justice department, really trying to merge kind of what I had learned and the valuable lessons I had learned in criminology and skills and expertise with kind of the orientation that I thought was needed to make the changes that I value. And that's very much this public health orientation and framework. And this department really reflects that. So I started a job here last year, really excited about this work. Now I'm working with the police department to focus on kind of an assets-based, youth-focused training so that police can understand how to interact with youth in appropriate ways, how to not hyper-surveil youth, how to not stigmatize them. And I'm hoping to find ways to work with the community as well for youth who've had these really adverse and hostile exposures to the criminal legal system. And so all that's to say, it's okay to have a windy path, right? I mean, I've been doing this for a while, but I feel like I'm just starting afresh in the past year. Because it's really important to follow your dreams and to really stand up for what you believe in. And if what you're doing doesn't reflect that, it's okay to switch paths, but you're all in the right place, I think, to do what you're wanting to do, because this is an awesome department. So excited to be here with you all.
Dylan, thank you so much for sharing your story with us and your path. And it's hard to imagine a different set of experiences to prepare you for the work that you're so deeply engaged in now. So it's really great to be reminded of how it is that you came to this path. And we're so glad you're in the department as a colleague and friend. So I'm sure many of you will enjoy connecting with all of our faculty and learning more about these stories and the work that faculty are doing. So really wonderful. And of course, I particularly like the fact that you wove in the life course theme. So that was an added bonus. So appreciate it. I'm going to invite Terri Powell to say hi.
Good afternoon, everyone. So I'm going to piggyback on Dylan and Alison's perspective. They'll get to what I do, but they'll start with something else. So they're really just two big messages that I want to communicate. And I should say also, I've been at Hopkins for 10 years, and I've been telling everybody that because that's unbelievable to me. I've not been anywhere for 10 years. So to be in one place for 10 years has been a lot. And I think that, everyone can be a teacher. And I have two daughters, and they are, so talking about kids, right? Two daughters, a 13-year-old and a 3-year-old, and they have been some of my best teachers. And two big lessons that they have taught me over the quarantine are two that I'd like to share with you. It's two that I've seen over my life, but two that I'd like to share. The first one is it's okay to restart. So similar to what Dylan was saying, right? I think that just the other night, my 3-year-old is learning how to use scissors. I know you're like, what? Who learns to use? Everybody at some point, right? And apparently this is when they do it. So she's learning to use scissors, and she really tries to force the paper. I'm like, hey, just restart, just take a step back and restart. And as we were talking and helping her go through it, taking a step back and restarting, I thought about how often we have to do that. And I just want to encourage you as students that sometimes you just need to take a step back and restart, right? You may be going down a road and you're like, this is it, I'm going to do it. And you're like, ooh, it's not going. And if the pandemic has taught us nothing, we have to be flexible and sometimes just take a step back and restart. Sometimes that means restarting the same thing. Sometimes that means restarting a new thing, right? I think that, you know, we are all here to help you and to grow and to make sure that we meet your expectations. Like, you chose us and we're so thrilled that you did. And yet and still, sometimes we have to take a step back and restart, whether this is with some of the course assignments or with the research projects or even with our advisors, right? Or, you know, with other students. Taking a step back and restarting sometimes allows us to get where we really want to go, even if it feels like we are taking a lot of time to do it. The second big important lesson that I've learned from my daughters over this year pandemic is learn how to best communicate with people, right? So I think we're in a system where we're like, if you don't answer my email or my text right away, I'm upset. I think we need to give people some grace. Like, first of all, maybe like email's not my thing, or maybe text is not my thing. And so with whomever you're working with, figure out what their thing is if you really want to talk to them, right? So I work with a lot of community partners, and email's not their thing. Like, I will email for days and I think it just goes into the abyss, right? Like, I don't know where it goes, but it doesn't get to them. I can call them, I could show up, right? Now that in-person things are okay, I could show up and probably get a better response than email, right? And so as you're thinking over the pandemic, my oldest daughter is 13. And so we, you know, she's a teenager. I feel like this life course, I'm all in this department with my family, right? We decided, so one of my close friends, she's like, you know, you give a lot of extrovert advice to your introvert daughter. Like, you really need to figure out new strategies to communicate. Because I'm always like, you know, be bold, go and say what you need, advocate, right? And so I asked her, I was like, you know, would you like to text me hard topics? Because she was like, yeah, you just always have so many questions. And I do. Like, I mean, I ask a lot of questions. She's like, and sometimes I'm just not ready. It's not that I don't have the answers, but you just ask so many all the time that I don't really know what to say and I get stuck. And then I think you get upset that I'm stuck. And so I was like, okay, let's try texting, right? And so she would text me things that she was thinking about during the day. And my response would always be like, oh, okay, let's talk at dinner. And so that gave both of us a chance to just figure out like what we wanted to say, what we thought about the topic, get over some of those initial like emotions, and then have a conversation that nobody was angry, nobody was, you know, like anxious, because we already knew that this was kind of coming at dinner, and we could have a conversation. And so as you go through this program, right, like think about like how people like figure out how you communicate best, but then also like think about the people who you really want to like hang out with, or you want to learn from or talk with, figure out how they communicate best. And try to meet in the middle, right? Like, I think that there's so many resources in this department, and I agree with Dylan. I think that there's like a fantastic department. I've been here again 2 years, right? Some folks a lot longer, but I just think that figuring out how to communicate with folks will do you well. Like, will be a lot. Will get you further than you want, especially when it's a hard topic, right? Like, not all topics will be easy. Cynthia mentioned I lead our IDEA work, which stands for Inclusion, Diversity, Anti-Racism, and Equity. That is not ever an easy topic, right? And so figuring out how to talk with people about like where they stand, how they feel, even when it feels uncomfortable, because we really can't face a lot of issues unless we can't deal with a lot of issues unless we first face them and talk about them. And so I've been learning a lot again from my girls about like communication and just restarting. And so I just encourage you guys as you move forward to always remember, one, that you can restart, and two, learning how to communicate with the people you want to communicate will keep the conversation going. So that's that.
Terri, I love that, all of your comments on so many levels, but the idea of communication being so key in everything that we do in life, whether it's with your own children, you got some love in the chat from others in the department, or whether it's with colleagues in the department, peers, whatnot. So I will keep that in mind moving forward. So thank you, I appreciate that. And I'm going to invite Shannon Wood to send greetings.
Hello, everyone. Thank you for joining us virtually today. So my name is Shannon Wood. I'm an assistant scientist in the department, and I guess about 1.5 years ago, finished my PhD in the department as well. So I am also going to piggyback on Alison, Dylan, and now Terry's stories to offer some practical advice, also with a story mixed in. So as a PhD student, I had the opportunity to work on several fantastic studies with wonderful faculty members. But the story and the project that I'd like to share about today was something called the Women and Girls Empowerment Module, which was part of PMA. And this was just a really fantastic study to think about moving all the way through the research process, and was really pivotal for me as a researcher. So Amy Choi, who at one point was director of the Gates Institute and was a senior advisor on PMA, knew that I was very interested in women and girls empowerment, but at the time PMA wasn't necessarily doing anything about it. And then later on, they received a small sub-award to create this module specifically for women and girls empowerment. So Amy came to me and said, I know that you're super interested in this. And simultaneously, Caroline Moreau went to Celia Karp, who was also my cohort, and said, hey, I know that you're really interested in it. So the four of us band together and said, okay, we're ready to go in and do this. So we reviewed all sorts of women and girls empowerment frameworks to really start and understand the literature. And then from there, we went on to implement what was deemed by one reviewer as a massively large qualitative study across 4 contexts. So this was in northern Nigeria, southern Nigeria, Uganda, and Ethiopia. And Celia and I at the time were, I guess, second year, third year PhD students, and had the opportunity to travel across contexts for consistency to implement this huge qualitative module to really get to know our research teams. And then at the end of all of this came to coding all of these interviews. And if you come to coding 440 interviews across very diverse contexts, this is quite the process. And so this took weeks and weeks and weeks on Skype. And then we had the opportunity to come together as a group and actually sit around a table with representatives from all of these contexts, trying to figure out, okay, well, what does empowerment mean in our context? And what does this mean for young women? What does this mean for older women? What does this mean for sex, for pregnancy, for contraception, for all of these pieces? And listen to all of their different perspectives, and eventually solidify this down into these quantitative items for implementation. And then later, this turned into scale refinement and all of these other pieces, which were really fantastic for the research process. But I give this as an example, similar to some of Alison's lessons, because first of all, really get to know faculty. So these opportunities might not be available to you at first, but faculty want you to knock on their doors or email them often in this point in time, because they want to understand what you're passionate about. And these opportunities, we might not have funding in place at the moment. Things might not have arisen, but they can connect you to other faculty members if they know about things, or keep you in mind for future opportunities as well. So share your passions. People want to listen and get to know you at this time. Second of all, really get to know the other people in your cohort. Exactly similar to what Alison said, these are going to be your future colleagues. You will continue working together for years. They will make you better researchers. They will make you better writers, co-write together, push each other. It's just a fantastic way to grow in research together. And then third, really get to know your partners. Figure out who's passionate about the same things that you are. We worked with so many different partners for this project, and not all of them were passionate about women and girls empowerment, and that's perfectly fine. But some of them really were, and they went back to Ethiopia, for example, and tried to understand all of the intricacies of what the Ministry of Gender was doing and all of the different IPV referral services. And these are now, your colleagues for future grant writing and training and understanding all of these different pieces in the context. So really get to know them and continue to cultivate those partnerships. That is all for me, and I hope to get to see you all in person one day soon.
Thanks so much, Shannon. So many great things for us all to think about. The notion of knocking on doors or emailing or texting, depending on communication styles, to really get to reach out to folks and get to know them during your time in the program here. And the fact that we all develop over time. So no matter where you're at in your career, what year of a program you're in, or what year you're on faculty, there's always more for us to learn and learn from each other. So you have great resources around you, and we are happy to make connections for any of you in ways large and small that help support you with where you're at and where you want to get to. So that's going to wrap up our stories for today. And what we're looking forward to do is sharing some more stories next Wednesday. So I really want to thank everyone for being here, for being so engaged. You'll find that over time, our seminars become very interactive as we invite speakers on topical areas. I appreciate all the comments in the chat. I think, Terri, you've inspired some of us with younger children to think about that texting idea, to initiate conversations. And it looks like one of you actually knows how to do scissor icons. So I'm going to follow up with you offline to find out how on earth you did that. So that was pretty cool. So thanks so much to everyone. We're looking forward to an awesome academic year. And please reach out to any of us in the department if we can help make those connections for you. And we look forward to learning and growing with you. Take care, everybody.